Hello, everyone, and welcome back to the Teacher's Desk, a place where teachers from around the nation talk about issues that other teachers are concerned about. And just a reminder that the thoughts and opinions expressed in this forum are solely those of the host and guests and do not reflect any thoughts of opinions in the school systems or workplaces where we work. Today we have an exciting part 3 with you on returning to school, and we're going to discuss some great things, information from a medical professional. Lori, can you introduce us? What are we doing today?
Sure. Today is part 3 of a 4-part series. We're going to be discussing returning to school in the fall, and we're going to discuss non-teaching staff with medical professional background, okay, that works in schools. So the example would be, I guess we can say a nurse, a school nurse.
Right.
We have many concerns. We talked about those concerns earlier. We talked about students riding the bus, eating in the cafeteria. Are those things safe medically? As far as social distancing, can we really social distance in a school? That's a concern of me. And what another concern I had is as far as keeping the schools clean and disinfected to prevent the spread of COVID. So these are some things that we'd like to talk about today. Lack of supplies in the classrooms, in the bathrooms. How can we ensure that it's going to be safe for students and teachers or staff to return?
Yeah, all of these are major concerns that I think teachers have, parents, and support staff, because we definitely can't leave out bus drivers and cafeteria workers, custodians. So we are excited today to have Jason Green with us. And Jason is a medical professional, and he has background working in the school. Jason, tell us a little bit about yourself.
Okay, how you doing, guys? So
Hey.
I've been working as a nurse for 16 years, and 6 of those years I spent in the school system in New York City. And there's a lot of concerns. There's a lot of things that you have to do as a nurse. Generally speaking, when the school season starts, so roughly about September and all the way to round about March. That's when you start to get the flu and the sick, the fevers and so forth. Generally speaking, without a pandemic. Now with the pandemic, it's gonna call on a lot more concern, a lot more fear, and unfortunately for the nurses that work in these areas, there's going to be a lot more cases for them to have to go through and figure out, is this something that's serious, or if this is something that's you know, that is a child just has, because things like the common flu and even the common cold still exist, even though we have COVID-19. But that's like the big fear right now. So uh, yeah, let's talk about it.
Yeah, so
Okay.
you've heard a lot of discussion surrounding what politicians are saying about we can go back to school, that it doesn't affect kids in the same way, that we shouldn't be fearful. Um, in your experience with kids and contagions and how things are spread, do you think that we should be concerned? Do you think that it's valid that parents are concerned about kids catching stuff and bringing it back home?
Yeah, I think kids a concern is very normal, so it's fine to be concerned. But the main thing is going to come down to your local area, your community. So what's happening in your area? As teachers and as nurses, you're going to have to be very adamant with checking the health database for the state, for your county, for your city and your community, and see what the virus outbreaks are in that area. And I think
Mm-hmm.
that's how the schools should take that data and decide how they want to move forward. Do they want to do virtual training, or do we want to have students in school at, like they said, in a hybrid fashion, where they have like some days when they come into school and some days where they do virtual training. But that's going to come down to the state, the community, and the county viral outbreaks.
So many school systems have already made some decisions about going back virtually or in place. For those of us that do have to go back in person, what are some things that we can do to help to keep us safe? We know about wearing masks and washing our hands. So what are some things that we can do to keep to be safe?
I don't know if this is probably a stretch, but if you've been to the DMV in the past few months, they have like a temperature check for everyone that comes in before you get inside. Um, I don't think that there's anything other than what we've been told to do to keep safe with yourself and your family in your own home. And if you have to go outside, which is like you said, the social distancing, wearing a mask, um, and making sure that you have supplies. Like you said, we're going to have this issue with running low on toilet paper, running low on, like right now, Lysol and wipes and these things are very
Yeah.
scarce in general. So, when school starts, it's going to be probably more scarce. But being able to, I guess, follow whatever protocol the school will have for sanitizing and making sure that the students. So it's going to be hard because you're going to have kids normally are not going to. Kids are going to be kids, So how do you get a kid to stay 6 feet away from another, from another kid of all ages, not just high school kids, for example, but elementary, middle school, same thing. The only thing you could do is just keep reinforcing that these are the measures that we have to take. We have to wash our hands. We have to, wipe down the surfaces after touching them. And if a kid is sick, the kid needs to follow up right away with, the nurse or, maybe parents have to pick up the child. The child is showing any symptoms. So those are the things that we're going to have to do over and over again. Is going to be quite tedious, but that's the only way that they can enforce like a safe school.
Do you think, Jason, that there would ever be, like, I know testing is a big thing and it's very costly, but do you
Hmm.
think it would ever come to the fact where we would have to test before actually attending school? Is that something that probably could happen, or what do you think about that? Is that something
Yeah,
possible?
I think so, but then I think that there's different types of tests. So I don't
Mm,
know if there's, you have this test that supposed to be looking for antibodies, meaning that you've had exposure to the virus. Then there's tests, but and then there's a nasal swab test, for example. But the thing is, a lot of these tests do not offer the same uh, return
mm,
results rather at the same time. So it may not it may be counterproductive because if you have to wait a couple weeks, 2-3 weeks after taking said test, then if you're talking about a student, is that student going to miss school for that space of time? So that person might be infected but asymptomatic and walking around and coming to school. So I don't know if that's going to be the protocol. At least that's not what they have been talking about with,
right.
with with regards to testing. There's a lot of issues with testing. They still have to work it out. They have to figure out a way to test on a wide scale and also to have those results readily available.
And
So
is it possible that you can test negative and still be positive? Like depending on when they test you?
that I don't know. I mean, I think that it is possible though, because there's there's been tests that people had who were positive went back and retested and showed that they were negative, and then retested a third time and showed that they were positive.
Hmm.
So
Mm.
there's a thing called false negatives
Mm-hmm.
that's been in the news quite a bit. I think in China they had a case, and a few cases probably here too. But I don't think that it's a sure way um, to say that there's this is a novel virus, so it's brand new. You know, it's just, you know, we're just learning about it,
Mhm.
and as we learn, the facts and the information changes. So I don't know if there's a set thing that we can do other than what the professionals have said. The scientists say, you know, the best thing that we can do based on the data is social distance. You know, is wearing a mask. Um, so the testing is still, I think the testing is still being worked out. I think that they're still working out treatments. There's been a few treatments in the news recently, and but I don't think that the treatments are very are etched in stone. I think there's some, you know, questions about some of the treatments that show effectiveness, but then in some cases there's some issues. So um, we just gotta wait and see. We gotta wait and see. The only thing that we
Yeah.
do know is that I think another thing too for the classrooms is ventilation. Apparently, they said the having good ventilation in the classrooms, in the schools, or in the place of business is a big factor too.
That's a
Um,
big concern because a lot of these schools are old. The HVAC system is outdated. And even if in another room, should we have some concern if the HVAC system is outdated, that it can spread through the school, through the vent?
yeah, right. So,
So- Go ahead. I was gonna just ask a question, but go ahead and finish your thought.
ooh, excuse me. Yeah, I mean, I think that those are things that do. The only problem with the ventilation is that, especially with the classroom, like if you, I guess, what, open the window and open the door, is that like once it gets colder, how comfortable is that going to be in the classroom, you know?
Mhm.
But now it's probably fine all the way up until like November-ish, when you can have like adequate ventilation in the classroom. But you still have to social distance. You still have to wash your hands. You still have to wear your mask and and try to be safe and pay attention to the state. There's an app. The Weather Channel actually has it linked on their app on your phone. You can download the Weather Channel, and they have an app where they track COVID-19, and it's specific to the county that you register um, in the app once you download it. So you can put your county in, zip code, and it'll give you the data um, to show you like what the infection rates were for that day, for the day before, for the month, and also for the entire state versus the entire state.
Mm.
And
What
I think, yeah,
What did you say the name of the app was?
the Weather Channel.
Oh, the Weather Channel. Okay.
Yeah, there's also CVS also has an app, has on their website a flu tracker.
Mm.
So it gives you like a scale that you can look at to see what the flu response is for your area as well. So you put a zip code in, and it can tell you if the flu risk is high or if it's low. But the Weather Channel started a COVID-19 tracker that's
Okay.
specific to the counties, linked to the health of the state that you put in, and it gives you a reading. And I think that administration would probably benefit by looking at the data. It doesn't have to be from the Weather Channel, but it could just be from the state
Mm.
department's website, and you can see the numbers in real time as far as um, what's happening in the state and in the county where the schools are located. And then they
Okay.
should make a good, just decision based on that information.
Yeah, that's good.
So I guess I have just one question for you. Last week we talked about concerns. I talked about my concern. Hope talked about hers, and our guests. One of the concerns I have is that I have an underlying condition, and so does my son. So I mean, I just want to know from like a medical point of view, do you think it's wise for us to? Well, I mean, I guess you can't really answer that question, but if school does open up, um, my plans are not to return possibly because I'm not sure if I want to expose myself. How do you feel like medically about that? Like as from a medical point of view, do you think that's something I
Mm-hmm.
should be afraid of, or should I be able to still go in even though it's a hybrid? Because what we're gonna do is they're going to reevaluate and look at the numbers, I guess, like you said, based
Mm-hmm.
on how it is in our county, and make a decision in December whether or not we are to return back to school in a hybrid model. But
Mm-hmm.
I have made my decision that I don't think I will because of safety. I mean, I feel
Yeah.
medically, So how do you feel about that?
I think that it's specific to the individual and your
Mm,
provider. So if someone is not feeling like they have a good history of health, that they're more at risk, that they should definitely speak to the doctor about that and see what the provider says. You let your doctor know that, hey, I'm a teacher. I work in a school. There's all different types of kids and staff that I'm going to probably come in contact with. How should I proceed?
right,
And with that information, then they can take that and go and let your personnel know. Listen, this is what my doctor said. So it's not like just me.
making it up,
This is how
right,
I feel. Person individual. Because some people probably are not as concerned, as you are. A lot of people, believe it or not, don't take as much initiative into their health. But because you're concerned about it, that's a good step. But I would say the second step would be to really speak with a provider, speak with a medical doctor, and see what they say. Particularly a doctor that, like, let's say if you take any medication, so the doctor is prescribing your medication, you speak with them and let them know, hey, this is my situation, and what are your thoughts? You know, and if it becomes an issue, maybe have your doctor put something in writing and say, hey, this is from my, so it's like, this is not, I'm not just making this up. This is coming from the doctor. He looked at, or she looked at the situation. This is what they think that I should do, and I'm going to take their discretion, you know?
Right.
yeah.
Now, I know that many school systems are saying that they are testing kids' temperature. I know that's one of the protocols of my school system. When we go back to school, that we are testing temperatures when they first come in. One of my concerns is bullying, in the
Mm.
regard of, we have some students that already have other conditions in which they cough, in which they might have a runny nose, allergies, and I don't want every time somebody coughs or sneezes, then people looking at them like, oh, you had corona, oh, you have, it can just turn into a big mess.
Yeah.
As a teacher, I'm always fearful. I could be, I wouldn't say it to a child, but I might think, wait a minute, he coughing. Does he have a corona? So what should be
Yeah,
some signs as a teacher that I should look for that would be different from the regular allergy call for,
I
something
think
that
that
really raises a flag?
yeah, I don't think you should look for anything different. I think you should look for the same thing. Don't think about COVID-19. Think about the normal day, normal time, and a student is sick in your classroom. How would you handle that? Would you send them or her to the nurse and have them look at it? And then what would you look for in that situation? Take COVID-19 out of it. Just basically, you know, what's an example of, I guess, a student in your class that doesn't feel well, or what would make you say, let me send so and so to the nurse?
Everything.
I think
Everything.
it's going to get to be a point
Yeah,
where teachers are just
yeah.
sending everybody
Everything.
to the
Go
nurse.
to the
It's like,
nurse.
oh, you sniffer, go to the
So
nurse.
that's
Oh,
why
you
when I
sneeze, go
started,
to the nurse.
I was just saying, I was like, the system is going to be overwhelmed. For the school, most school nurses are trying to get. If you speak to a majority of the school nurses, they'll tell you, "Oh, I used to work in the hospital for X amount of years, and it's kind of a respite for them to come to the school from the
Mm.
hospital." But now with COVID-19, it's going to be, because most times you have maybe one or two nurses in a school with a couple hundred kids, a couple of
Mm-hmm.
handful of kids, and now if they open up school, teachers are going to be sending their students down,
All the time.
and
Yep.
then
All the
some
time.
students,
And you talking
Yeah.
about one nurse for a couple of thousand kids. And
Yeah.
Yeah.
I am one that don't have windows in my classroom. And I know that's not uncommon. So like you said before, for ventilation, I wouldn't have a window to open to get ventilation. And
Hmm.
I don't know if the school systems might rethink the door open policy, but I know because of concerns about school shooting and other safety measures,
Security.
we are
Hmm.
encouraged to keep our doors closed and in many situations locked. Um, Also, just as a courtesy to your neighbors with the noise level in the room or what have you, if you're talking loud, just for some privacy. But we might have to rethink that and open those doors, because if we don't have windows, we do need that ventilation to get out.
Yeah. Yeah, I think you gotta just err on the side of caution. And if a kid is saying I feel sick, they need to go to the nurse. And the nurse will, take whatever precautions that they take to judge whether or not they need to call the kid's parents to pick them up.
Yeah. And I know sometimes we have a concern that we send kids to the nurse and the nurse sends them back. And I'm just
Hmm.
cautious to
Yeah.
how that is going to go. And I know sometimes the nurse is like, you send them down, there's nothing we could do. Like, stop sending kids to the nurse for every little thing. But I think, like you said, school nurses are going to be overwhelmed, because I can see
Yeah.
teachers sending kids for every sniffle, every cough. Your eyes don't
Yeah.
look good, you look tired, go to the nurse. And
Yeah.
are they going to have an issue if those kids get sent back? Like, oh, they sending them back, and I think something is wrong with this child. So
Hmm.
it's going to be a catch-22 that we do have to keep our school nurses in mind as we go through this situation, that they are going to be overloaded and overwhelmed.
Right. Yeah. I mean, you're gonna have out of the handful of kids that are sick, you're gonna have a large percentage of those kids that probably aren't needing to go home, or needing to go to come back and provide a doctor's note. You might just have somebody who wants to get out of class for a couple hours, and they
Yeah.
may have a stomach ache, or and but again, even in a normal setting without COVID-19, those are things that as a teacher you have to do. If a student says that they feel sick, you got to send them to the nurse, and then as a nurse you have to assess and you got to evaluate whether or not this is somebody that's actually sick. And there's a few things that they'll do: check the temperature, and if you know the student, well, because I guess I'm thinking about where I was. Most of the students there were on medication, so we took a little bit more into consideration when a kid was sick. And so, but generally speaking, sometimes you have to contact the parents to pick them up, and then that becomes an issue. So a lot of parents are saying they can't leave work, and they can't
Hmm.
stay
Mhm.
home with the kids.
Yes.
So they're pro sending the kids back to school, because
Mhm.
that's the time that they would normally be at work when the kid is at school. So it's very, I don't know. We'll see how they decide to do it. Like I said, but um, every specific area is going to have its own way of how they deal with it. So, for
And
example, I
Jason,
think
you
in New
are where?
York,
You in New York?
I'm in Delaware. I'm in
Oh, you in
Delaware State.
Delaware.
So
So have they
Delaware,
decided up there whether they are going virtual or in person?
I think that they decided. I think, don't even quote me. I'm not 100% sure, but if I remember correctly, I think they decided to do like 2 weeks, a short period of time virtual. And
Mm.
Okay.
and again, I think that the reason for them doing that is probably to see what will happen over the
Yeah.
course
Well,
of a month, over the course of a week or two.
Well, I don't know. I know I've been looking at the news and I've been seeing what's been happening to these school systems that have been opened early. There's been a few cases. When you were talking about the kids, their parents not being able to pick them up. I know in Indiana there was a case where a child was sent to school and the parents knew he was sick because they tested him for COVID and he ended up was positive and was
Yeah,
sent to the school system. So it's like every day it's a new system, a new school system, a
Right.
yeah,
new something new. 260 people I think in Georgia, staff members were positive. It's just always something new, so like you
Right.
yeah,
said, changing every day,
That's
um
true. That's true. And the student that shared the picture of the
oh,
hallway,
yeah.
that's a concern. You can't social distance when you had that many kids trying to get there in a short amount of time.
Probably not.
I
When
think
we
some of
talk
the
about
kids
school
in
buses,
that, if it's that same picture that's been on the news, not all the kids had masks on.
No,
Some of them
you're
did,
right.
and some of
no.
them didn't. And then apparently they ended up having a few kids test positive like the
Hmm.
next day or something like that. They had
So
to
Well,
close the
school
school.
systems, not surprising. Well, surprisingly to me, I know my school system is one that are not requiring kids to wear a mask in class. They said that
wow.
Hmm.
they have to wear it in the common area. So, like, if they were going through the hall, they would, but then they
Right.
could get to class and take them off. And I know while masks might be protective, I know the kids touch stuff. They have lockers. Um, they can cough in their hand in the class and then go out and
Hmm.
touch the lockers and somebody else touches it. And what's to stop that from bringing it to class? Because they touch their
Yeah.
faces all the time, put their hands in their mouth all the time. We have kids that suck their thumb and suck their fingers and,
Yeah.
just be emotional and wipe their eyes. So while there are some things that they're putting in place, it's just so many areas that we can see that I don't think that people are really taking into account when we're looking at the big picture. That
No.
And I don't hear them talk about staff enough. I hear them talk about the students and they talk about the mortality rate and then with the students that are affected, but I don't hear them saying anything about the staff. I don't hear them saying anything about the custodial staff. And most of them that are over, the ages of 45, 55 years old. I don't hear them talking about the people that work in the offices, but all
mm,
just the staff in general.
Yeah.
And you just don't hear enough about that. You hear about and again, we have to talk about the kids because they come first. We got to protect the children. But again, when you talk about school, it's like you're talking about the area, the community, the neighborhood, because you have people of all ages. You have the adolescent, the child that's going to the school, but then you have staff that are the teachers, that are the janitors, the
mm,
people that work in the kitchen
Yeah.
of all different ages, with all different medical backgrounds and so forth. So it's like it's it's a on. I think it's an ongoing conversation, and
Yep.
I think
mm.
that they won't have nothing's etched in stone. They're gonna try and see what'll happen, like they did in Georgia. Hopefully, they won't open up school because I've seen on the news. I think today the schools closed for 2 days.
2 days.
But I'm
That's
like, yeah.
you're right.
So
I heard
I,
too.
do they need do they need to be closed longer than 2 days? Like,
Hmm.
who knows? We have to see. But a lot of people are at risk, not just
Right.
not just the kids.
Right.
So, and I think that it's a good talking point because the kids have lower cases of mortality rates, but you're talking about kids that are going to go home,
Mm,
to their parents, to their grandparents, and or kids that are going to be around staff in the school of all different ages. So
yep. Well, Jason, we are so glad that you came on
Yeah.
today. I mean, you have just given us a lot of food for thought and
mhm.
really answered, verified some things that we were already thinking and just gave us some new things to think about. That as
Yes.
teachers, that we have got to look at the ventilation in your classroom and decide
Yeah,
what you are going to do about that. Whether you got to buy some fans, open windows, administration does need to make some decisions about if we can leave the doors open and those type of things for people who have inside classroom that don't have windows attached and
yeah. I
just
think
be
they have to be open to have continuous discussions, meaning that whatever decisions we made at the meeting yesterday is going to be changed by tomorrow or the next week. So they're
Yeah.
going to
Right,
have
right.
to constantly come up with ways to keep communication open, and I think that will be the most effective way. So
Yeah.
Right.
Well, thank you, Jason, for sharing
Thank
your
you,
views
Jason, for
on the
coming.
teacher's desk. We appreciate that.
Yes. So next week we will be continuing by looking at talking to some students, as well as giving parents some tips on how to set your children up for success. That whether they're going back virtually or in person, some things that we think that you might need to know. So everyone, have a good evening and take care. Bye.
And if you're watching us now and have not liked us on Facebook, please like us and follow our page and subscribe to our YouTube channel. Bye.
Thank you. Bye. Have a good evening.
bye.